Diabetes and cinnamon. Can this simple spice really lower blood sugar? A lot of people are talking about it, but what does the science say? Stick around, because in the next few minutes I'm going to break down how cinnamon affects diabetes, the best way to use it, and some important warnings you don't want to miss. Cinnamon has been used for thousands of years, not just as a spice, but as a natural remedy. From ancient Egypt to traditional Chinese medicine, people have believed it has powerful health benefits. But now, modern science is starting to confirm something fascinating. Cinnamon may actually help people with diabetes manage their blood sugar. So, how does cinnamon work in the body? Research shows that certain compounds in cinnamon can mimic insulin, the hormone that helps your cells absorb glucose from the blood. In simple terms, cinnamon may make your cells more sensitive to insulin, so sugar doesn't just stay floating in the bloodstream. Several studies suggest that consuming cinnamon regularly could reduce fasting blood sugar by 10 to 29%. That's a big difference for something as simple as a kitchen spice. Now the big question, how can you use cinnamon if you have diabetes? The easiest way is to sprinkle it on foods you already eat, like oatmeal, coffee, tea, smoothies, or even roasted vegetables. Ceylon cinnamon, often called true cinnamon, is considered the best choice because it contains less coumarin, a compound that in high amounts can affect the liver. Cassia cinnamon, the type most common in supermarkets, also has benefits, but it's best in moderation. Experts often recommend about half a teaspoon to 1 teaspoon a day. That's enough to get potential benefits without overdoing it. But here's the important part. Cinnamon is not a cure for diabetes. It can support blood sugar control, but it doesn't replace medication or lifestyle changes like exercise and a healthy diet. And if you're already taking medication for blood sugar, adding too much cinnamon might make your glucose drop too low. That's why it's always smart to talk to your doctor before making cinnamon a daily supplement. So, does cinnamon help with diabetes? The answer is yes. Research suggests it can improve insulin sensitivity and lower blood sugar, but it's not magic. Think of it as an extra tool in your toolbox. If you want to try it, start small, choose quality cinnamon, and track how your body responds. Now I want to hear from you. Do you already use cinnamon daily? Would you add it to your diet after hearing this? Drop a comment below and don't forget to like this video and subscribe for more natural health tips. Thanks for watching, and remember, small changes can make a big difference in managing diabetes.